Opioid addiction, a devastating disease, has grown to epidemic proportions in the U.S. and into what many are now calling a public health crisis. According to recent reports from the CDC, 78 people in the United States die from an opioid overdose each day. Research shows that combining evidence-based medication with behavioral therapy is a successful approach for most patients. However, there are few medications approved to treat the disease. Recognizing the need for innovative approaches to treatment, Braeburn Pharmaceuticals is bringing a new treatment in the form of an implant for opioid dependence. Joining Access Health to explain what the science tells us about treating opioid dependence is psychiatrist Dr. Amit Vijayapura.
So during my practice in the last 10 years, I have seen significant increase in problem related to opioid addiction. It has been declared as a national health crisis. It destroys patient life as well as family life.
What seems to not be working is rehab by itself. Scientists are showing traditional treatments alone leads to relapse 85% of the time, creating a vicious rehab addiction cycle. Many people do not recognize this as a disease and are not aware that there are medications available to treat it as such.
In 2008, I was on my way home from dinner with my parents, and I was rear-ended by a drunk driver. He hit me going about 65 miles an hour. So the damage between the speed and the position of my body was pretty severe. I chose to do different types of treatments versus medication. As time went on, I was unable to continue working. So at that point, I lost my health insurance. So alternative treatments really weren't an option any longer. And my doctor was like, you can't afford alternative treatments. What you can afford is opioid medication. It was a vicious cycle until it got to the point where he was no longer comfortable increasing the dosage. And so I began seeking it elsewhere.
A lot of people still don't know that opioid addiction is a medical disorder. People always relate any addiction as a personality flaw or bad habit.
I didn't know what to do to get help. I'm diverting funds from our home to pay for this. We lost our home. We lost everything we had. We moved into my parents' home. They didn't find out until they accused my husband of stealing. And it was at that point that I finally came clean. I said, no, it's me. I'm taking. I was stealing from them and pawning things to buy pills.
A lot of people think that if you have addiction to opioid, you can stop the opioid medication and not have to worry about it the rest of your life. But now we know that opioid addiction is a chronic relapsing disease. That means you are going to deal with this rest of your life. And you have to handle that disease like any other chronic disease, such as diabetes, cholesterol problem, hypertension. These are all chronic disease. Major breakthrough in treatment of addiction happened when FDA approved the first partial agonist treatment called buprenorphine. Buprenorphine is very effective in controlling the withdrawal symptoms and preventing the relapse. Many patients who've been diagnosed, they need a long-term treatment with something like buprenorphine.
When it comes to treating opioid dependence with buprenorphine, Dr. Vijayapura shared some of the challenges that the new treatment, Probufene, aims to address.
Physicians were concerned and afraid of buprenorphine itself being abused by patients. Their children can get exposure, the family member can steal it, friends can steal it, or patient can abuse it and sell it on the street.
In May 2016, the FDA approved the first buprenorphine implant for the maintenance treatment of opioid dependence, as well as a fast-track approval based on the limited potential for diversion and pediatric exposure. Dr. Vijayapura has more.
Patients who are currently stable on buprenorphine at 8 milligram dose or less they are a good candidate for Braeburn implant. Braeburn implant is inserted under the skin with a very small incision. Braeburn implant will deliver medication, which has been proven effective in treating opioid addiction every day, 24/7, for 6 months. We want to make sure that each patient is properly educated about the nature of the disease and what they can do.
Because of the risk of complication of implant movement sticking out or coming out of the skin related to insertion and removal of Braeburn, it is available only through a restricted program called Braeburn REMS program. Please see important safety information at the end of this segment.
The prospect of reduced relapse and misuse with Braeburn are significant in many ways.
Now the medical research suggests that patients who go through detox and abstinence-based treatment, they still have a significant relapse potential. Compared to that, if you provide a long-term medically assisted treatment with group therapy, with behavior therapy, you have a much better chance of preventing the relapse.
The number one thing for me was my children's safety. I'm doing better than ever. I truly believe that that's how we got here. A lot of prayer, a lot of blind faith, and directing us to where we landed.
Special thanks to Sarah Wilson for sharing her story. If you or a loved one suffer from opioid dependence and are currently stable on 8 milligrams or less of buprenorphine, talk to your doctor to understand whether Braeburn may be right for you or your loved one to help treat this chronic brain disease. To find a Braeburn provider near you, visit Braeburn.com. And thank you for joining us.